Hi, I'm Dr. Kiran Coelho, a senior consultant, minimal access surgeon and infertility specialist at the Reliance Women's Wellness Center. Now, how do you diagnose an ovarian cyst? Your doctor may detect an ovarian cyst during a routine pelvic examination. The doctor may notice a swelling in one of your ovaries and order an ultrasound to confirm the presence of a cyst. Ultrasound is an imaging test that uses high-frequency sound waves to produce an image of your internal organs. Ultrasound tests help determine the size, the location, the shape and composition, whether it's a solid or a fluid-filled cyst in the ovaries. And other imaging tools that may be used to diagnose ovarian cysts include a CT scan, which uses a body imaging device to create a cross-sectional images of the internal organs, or an MRI, which uses magnetic fields to produce in-depth images of internal organs. Now, management. Because most cysts disappear after a few weeks or months, the functional cyst, there is not really necessary an immediate plan of action for treatment. Instead, you may just repeat the ultrasound test a few weeks or months later to check whether the cysts have disappeared. In certain cases, no further monitoring will be needed, especially if you have had a follicle cyst or a corpus luteum cyst. And the only time that we would treat is if there are persistent cysts. Now, these other tests which can be done is hormonal levels, sonography, testing doing an MRI, following up whether there's too much of estrogen or progesterone. Now, what are the treatments for ovarian cysts? Most ovarian cysts are benign and naturally go away on their own without treatment. These cysts cause little, if any, symptoms, and just a little bit of painkillers, heat therapy, rest, etc. are more than enough. Some of the larger cysts like endometriomas or cancerous cysts need to be removed surgically. The options for surgery include laparoscopy. Laparoscopy is the gold standard. It is a keyhole surgery where we make tiny incisions near the navel, insert a small instrument into the abdomen and remove the cyst. Now, the next is laparotomy, or an open incision, and in this procedure, a doctor can surgically remove the cyst through a large incision in your abdomen. This is known as laparotomy. This way, the cyst is removed without rupturing or spilling any of the contents. And this is especially so when you're concerned about cancer. Now, let us see the complications of ovarian cysts. In rare cases, there is a cancerous cystic ovarian mass during a routine examination. Sometimes the ovarian torsion occurs. It occurs when a large cyst causes the ovary to twist or move from its original position, and the blood supply to the ovary is cut off. If not treated, ovarian torsion can cause damage or death to the ovarian tissue, and the ovary may have to be removed. Then the other complication are rupture of the cyst. Ruptured cysts can cause intense pain and internal bleeding, and this complication increases the chance of infection and can be life-threatening if left untreated. Now, how do we prevent ovarian cysts? Usually, ovarian cysts occur during the reproductive age group of a woman. And if one has recurring ovarian cysts, then usually we prescribe oral contraceptives to stop ovulation and prevent the development of new cysts. Oral contraceptives can also help reduce the risk of ovarian cancer. The risk of ovarian cancer is higher in postmenopausal women, and therefore, when we detect ovarian cysts or tumors in a postmenopausal woman, they have to be identified and removed immediately.